Have you ever noticed a rash appearing on your child and wondered why? It looks exactly the same on both sides of their body, almost like a mirror image. It can be quite puzzling to see those identical bumps or patches show up in such a precise pattern. Well, to directly answer your question, yes, hives, also known as urticaria, can absolutely show up symmetrically on both sides of the body. When hives appear in this mirrored fashion, it often points towards a systemic reaction, meaning something inside the body is triggering the response rather than just a local skin irritant. Hives are essentially an immune system response where specialized cells releases histamine and other chemicals into the bloodstream. This surge of chemicals causes tiny blood vessels to temporarily leak fluid, leading to the characteristic red, itchy, and slightly raised welts we recognize as hives. When the trigger is something ingested, inhaled, or part of a widespread infection, these chemicals circulate throughout the entire body. Because the immune system is responding systemically, it makes perfect sense for the skin to react generally across the body, often resulting in that distinct symmetrical pattern on both arms, legs, or torso. Common culprits can range from certain foods or medications to viral infections, insect stings, or even environmental allergens like pollen. If you observe symmetrical hives on your child, start by gently observing the pattern and any other accompanying symptoms, such as fever or swelling. Try to recall any new foods introduced, recent medications, or environmental exposures that might correlate with the onset. It is always a good idea to consult your pediatrician to help identify the underlying cause and determine the best course of action. In the meantime, cool compresses and loose, comfortable clothing can help soothe the itch, and your doctor might suggest an over-the-counter antihistamine specifically for children if appropriate. Interestingly, the symmetrical nature of hives can be a crucial clue for your doctor. It often helps distinguish true allergic reactions from contact dermatitis, which usually appears only where the skin has touched an irritant. While some hives are caused by physical stimuli like pressure, known as dermatographism, these typically do not present symmetrically across the body. When you see symmetry, think about an internal trigger. Keeping a simple log of when the hives appear, what your child ate, or any new exposures can provide valuable insights for their medical provider. Understanding that symmetrical hives often signal a systemic reaction is a powerful piece of information. It guides you and your healthcare provider toward investigating internal causes, leading to a more accurate diagnosis and a more effective plan to manage your child's symptoms and prevent future occurrences. This knowledge empowers you to be a proactive partner in your child's health journey.